AI hype is everywhere in healthcare, but beneath the noise, many organizations are achieving significant life-changing impact. Today, we're exploring what it takes to go from POC to ROI, and our guest today has the real-world roadmap. Welcome back to HumanifAI Healthtech, where we explore how AI is rewriting the rules of healthcare and putting people right back at the center where they belong. I'm your host, Francesca Vereb, Head of Marketing at NetHealth. Today, we're tackling the question everyone's asking about enterprise AI. How do you move from pilots to real, scalable practice? And joining me is someone who is currently leading that exact transition for thousands of healthcare providers, Eric Grover, NetHealth's Chief Technology Officer and our resident AI truth teller.
Thanks, Francesca. I'm really excited to be here today. It's an exciting topic and so much is happening. It's going to be fun to talk about.
I know, and it's certainly a topic that when you and I get together and start to kind of go through, I definitely see you light up. And I know recently we were together with a bunch of other execs and we were talking about AI, and you actually framed AI as actually sort of being this tool that's ushering in an age of miracles. Can you tell me a little bit more and tell the audience a little bit more about what did you mean by that and what should leaders really be ready for?
Yeah, I mean, it sounds fantastic, right? But it's really true. I mean, just even today, we're not talking about what's coming soon, but even today, scientists are doing things like mapping out tumors inside cancer patients to be able to give them their own personalized mRNA vaccine to target their tumor cancer cells rather than the traditional, chemotherapy approach, which is sort of a carpet bombing approach to treating cancer. So they're able to actually create personalized vaccines today for cancer patients based on their specific tumor. Other things like they're able to do things like synthesize speech from brainwaves for people who have lost the ability to speak. Really, just the number of things that they can do with creating new molecules in biology. The breakthroughs we're going to see in the next 3 to 5 years, I think, are going to be breathtaking.
So true. And I remember you actually citing a particular case where you said even aging is something that they're tackling. And I think you and I had a good giggle over that, if human life was extended to 150 years, would we have to work to 125 before we could retire? So, but jokes aside, you also do a lot of work with PE firms like Carlyle and the Level Equity Group and others. And you counsel a lot of execs and you sort of talk to them a little bit about like pilots and what really distinguishes a pilot or putting that workflow into practice. Tell us a little bit about how folks should think about scaling AI successfully.
Yeah, when I talk to folks about really going live with AI, there's a lot of similarities between enabling AI and digital transformations that have been going on for the past 10, 15 years. So as people have sought to bring in automation through technology into their environment, a lot of the same principles apply. One of the things I think that people often get wrong is they come with a technology and they have a solution in search of a problem. And so they try to implement a technology that may be cool and may be really slick in some ways, but they don't have a specific business problem they're trying to solve. And so what I encourage people to do is really understand your business, understand where you have pain points in your processes and where you have processes that require a significant amount of human manual effort. And let's try to pinpoint those specific pain points and find solutions for them, whether that's through AI or through traditional technology. And so I think a lot of times we tend to lean into what's the latest, newest thing and lose sight of the tool, all the tools we have. And I think by combining traditional tools and traditional software with AI, sometimes you can come up with the most impressive solutions.
I agree. I think before we dive a little further into that really poignant point, one thing I just wanted to kind of ask you to sort of explain is because you do talk to a lot of leaders, not just in the healthcare space, but you focus a lot on, especially like at NetHealth, a lot of the stuff that you're doing with the clinical environment. So how do you speak to these executives and try to help them bridge this gap between clinical speak and technical speak, especially for those that are not deeply fluent in either, but they hear a lot about this AI buzz? What do you coach them on, and how do you explain AI to those executives?
So one of the things that I've really found to be true is that a good 90-second demo oftentimes helps far more than me trying to use words to explain something. And so if I can get them a demo of something, instantly the conversation becomes clear. So that's the first thing. I think also just realizing that you know AI is not a magic black box, and we can use simpler analogies for the things that are more complex. But I think most of the concepts are fairly relatable once you break them down for people. And you don't have to be an AI scientist to be able to understand some of the basic concepts of how AI works.
Very true. Very true. You also touched a little bit there on shiny penny syndrome, as I'll call it, when you said, AI's got a lot of interesting innovations, and a lot of organizations have sort of been in that like pilot program. How have you coached folks to shift from that shiny penny syndrome more to deciding how they should be building these things natively in workflow? What is the guidance that you give them, and what are the advantages that creating AI in native workflow actually creates for organizations?
Yeah. Well, you bring up a number of really important things. I think that the most important thing when you're trying to adopt a new technology is you need to have buy-in, both from the executive level and understanding what the goals are and making sure that those goals match the problems that the people in the ground are trying to solve. And so if you don't have alignment to begin with, you're probably not going to be successful. So, I find a lot of times executives will hear about a new technology or a new product and want to bring the value that they've heard has been achieved elsewhere into their organization without really understanding the pain of their specific organization and the problems that they're trying to solve within their organization. So I think getting alignment is key. And then I think being able to measure success is also key. So when we're adopting a new technology like AI, one of the most challenging things is to say, well, how are we going to know if we succeeded, and how are we measuring that success? So being very clear up front about what your goals are, how you're measuring your progress, and being able to understand, if we solve the business problem, then we've succeeded, regardless of whether we think that we've done every cool AI thing that we have in our tool belt. But the point is solving problems.
Don't most executives tie success to, dollars saved or ROI, or are there other measures that they should be thinking of along the lines of what you just said?
Yeah, I mean, obviously ROI is important, but also provider satisfaction and provider quality of life is super important. We're building our own ambient documentation features right now. And one of the most significant things about that is right now, the mental health of providers is super important and is really under fire from the load of administrative burden that they have. And so, while yes, there's ROI on it, there's also protecting the people who are caring for patients. And it's really important that we use technology to enable solutions for that problem as much as we can. And I would also just say the quality of care we provide patients as well, and the outcomes of the patients is really what matters in the end. If we can use technology to improve patient outcomes, whether or not there's ROI on it for the providers, that's really ultimately what matters.
So, I mean, that's such a key point, because it isn't just the pressures that we're feeling from the economic environment. It's also, like you said, the mental health of those patients. It's also ultimately what a lot of practitioners and providers got into business for originally, which is to really ultimately serve the patient, right? And make sure that patient's getting better. And in that context, you described AI sort of being part of that workflow and really being ingrained. So just put a finer point on that. When you take AI and you deeply ingrain it into a workflow rather than bolting it on the side as a different capability, what are the benefits that come from that type of augmentation or that workflow integration versus, again, a separate tool that they have to log into for AI capabilities?
Yeah, that's a great question. When we looked at how we would enable ambient documentation within our EHR applications, one of the questions we asked ourselves is, does a point solution or a bolt-on solution actually address the root problem that our clinicians are facing that we're trying to solve? And our answer was no, it doesn't. And because a lot of these point solutions, most of these point solutions, will take a transcription of a patient encounter, and they'll extract from a note, a SOAP note, for example. And that note, while being helpful, does not do anything to actually fill out the EHR's documentation. The clinician still has to take the data from that note that was generated and still has to do the documentation themselves. What we thought was, we have specific specialized EHR applications that we can tightly couple the extraction of that data from the transcript and put it right into our EHR application. And we can actually solve the fundamental problem, which is the amount of time it takes those clinicians to actually fill out this documentation. So we're not going to do a half measure. We're going to go all the way and try to solve the underlying root problem.
That is so amazing. There are a couple of things there. So you're really leaning into the intelligence side of the initials AI, right? The artificial intelligence. I think that's fantastic. For some of our listeners that are not familiar, can you just quickly clarify what a SOAP note is? And then I'll ask you a follow-up question on that.
Sure. So a SOAP note is a standard clinical note that describes, when you're taking a patient encounter and trying to come up with the standard categories for how you would talk about your observations and what your recommendations are for that patient. It's an acronym, and I don't remember all of what SOAP stands for, but SOAP is a standard clinical way to take notes and documentation from a patient encounter. So EHRs like the ones that NetHealth builds are specialized to the disciplines that we are serving. So, for example, physical therapy, we will have much richer documentation that's specialized for a physical therapist beyond a generic SOAP note. So if all we do is create a SOAP note, then we have lost the value that our EHR brings to begin with, which is a specialization in the disciplines that we're trying to serve.
Right. Right. And everything that you described there in terms of that transcription and the intelligent sort of context that is being layered on, that is all part of what you refer to as ambient documentation. Am I correct in that? Or is there a better definition for what ambient documentation really is?
So ambient documentation kind of has a fuzzy definition depending on which EHR provider you're talking to. For some people, ambient documentation could just be creating a transcript from the patient encounter, right? For others, it's taking that transcript and creating some sort of summary like the SOAP note. But really, there aren't many people in the industry who are attempting to do what we're doing, which is to actually populate the EHR's documentation with structured data. So if there's a drop down, we're picking the right choice from that drop down. If there's a checkbox, we're choosing whether or not to check that checkbox, or if there's free notes, we're creating language to populate those free note fields. And that's really unique compared to other EHR providers.
I think that's fantastic. And it's also, you mentioned EHRs. Just to put a finer point on that, I mean, your history is vast, but at NetHealth specifically, you're building EHRs, which are really just a way for us. It's sort of a marketing CRM. It's sort of a database, essentially a platform to be able to keep all of the healthcare information. And we work across the senior living space. We work across hospitals in the domains of wound care and rehab therapy. So just to give the listeners a little bit of context there. But moving on from that, just talking more broadly about the healthcare industry at large right now, there's a ton of margin compression. There are a lot of just, lots of pressures that the teams and these providers and healthcare, organizations are struggling with. So when we think about that, how does pricing and reimbursement pressure influence AI adoption, especially in sort of the post-acute environment, but also in private practice environments?
It's a great question. And we are really trying to create a pricing model for what we're doing that acknowledges that reality. The truth of it is, every organization is shaped differently. You have different kinds of, patients who in your population who you're serving. And so we want a pricing model that reflects that. So what we thought is it's best to price according to the actual usage of the output of the AI. So for ambient documentation, for example, we're going to charge you for how many documents you create with the ambient documentation feature. So if you're a small facility and you're only creating, a limited number of documents per month, you're going to pay a lot less than a larger facility that may have the need for a lot of documentation. So we're trying to make it so that smaller facilities find AI accessible in the same way a larger facility would.
I think that's excellent. And then if you double click a little further on that, what about those providers also looking to manage their revenue cycles? Is there any, perspective on that as far as AI is concerned?
Absolutely, and that's where we're headed in 2026. We've got to focus on a lot of RCM features. Being able to audit, for example, which payment codes, CPT codes, are being applied. Is there document? Is there a case that's been documented to support that code, or are there codes that we have support for that we haven't chosen that could be added to it? Right? Being able to do prior auth validation, being able to automatically audit a bill before it gets submitted, so that if there's specific problems that we routinely run into in getting approvals, we can identify those before those bills are submitted. So we've got a backlog full of RCM related features that we're excited to build in the upcoming year.
Tell me a little bit more, Eric. Like, what does that actually look like? I might be a clinician who, I'm really good at my job, or I'm a therapist, a rehab therapy therapist. I'm not really necessarily a billing expert. Are there things in there that the AI tool is going to help me with? Like, just describe a little bit of those features, maybe one step further for,
Sure.
for someone like
So,
me who's not as familiar.
Yeah. Let's say I'm a physical therapist who is trying to apply a specific CPT code, to bill for a specific service, and in order to get reimbursed for that service, I have to have specific things documented in the patient record to justify that CPT code. The application then, if I choose a CPT code, number one, it can suggest, based on what you've documented so far, these are the CPT codes that are supported by what you've documented. And number two,
So
after
smart.
you've chosen codes, we can go back through and look and say, well, actually, you could have selected these. Are you sure you don't want to apply these additional codes? And one of the things we're really convinced of is that we need to build this kind of functionality into the existing workflow of the application and not have it be a separate feature that the user has to go hunt for. So right within the workflow that they're already using and they're already used to, we want to bring in prompts and suggestions right into that workflow. So for them, it doesn't seem like they have to learn a whole new workflow or a new tool, but this is intelligence built into their existing workflow to enable them in things they're already doing.
So kind of like an invisible partner that's helping you with all your healthcare automation in whatever workflow. We spoke a little bit about billing here, but pretty much any workflow is what you're saying, correct?
Correct. Yeah.
That's amazing. So from your deep history, and also, I know you go out on this speaking circuit and you coach a lot of folks, a lot of executives. When you're thinking about building and engineering around this sort of trust sort of structure for AI, that admittedly out there's a lot of buzz about, do people really trust AI? Don't they trust AI? What is your opinion about what needs to be true for executives to be able to trust AI inside clinical workflows? And this is pretty much aimed more at like the advice you might give to those providers, those technical folks that are thinking about AI governance, etc.
It's a great question. And there's really three things that I say you need to know before you deploy something. Number one, is it explainable? So can I explain why the AI did what it did? Number two, is it accountable? Is there an audit trail of every decision or every output that an AI has created? Right? Can I go back and can I verify through an audit trail of what specific things the AI has done? And the third is it controllable? Can I turn it off? Can I dial it back? making sure that I have control of it, and then I can specifically, if there's something that's identified that is incorrect or unexpected, I have the ability to immediately flip a switch and turn it off or dial it back to specific use cases. So those are the three areas that I recommend people really take a look at and make sure that they're comfortable with before they deploy a production solution.
Sounds great. And then let's take the opposite side of that. What do you think they may not be asking vendors that they're evaluating today? Like, if I had to get inside Eric Grover's brain and say, hey, I'm evaluating a solution, they're bragging about AI. I don't know if it's marketing fluff or if it's real. What are those questions that those decision makers should be asking vendors and partners that they usually don't?
I would ask a vendor, what happens when the AI gets it wrong? Because inevitably, and the models are getting better and better all the time. AI will only be better than it is today. Today is its worst it will ever be, but it still makes mistakes. It still occasionally will hallucinate something or not get something right. And so the question I would ask is, what do you do, or what does your product do when that happens? How are you planning to put guardrails around that scenario when it happens, so that you're ready for it?
Yeah, that sounds great. And Eric, what has been the biggest surprise that you've encountered as you've sort of embarked on this AI journey? I know we're going to sort of define it as the last sort of 2-ish years, but I know candidly you've been dabbling with AI for so much longer. What has surprised you the most about AI?
That's a hard question. I think that the rate of change constantly still surprises me. Even though I anticipate it's going to change quickly, when it does, I'm still, my breath gets taken away with how fast things are changing. If you think back in January of this year, where we were at as far as the large language models and what their capabilities were, and you look at now today with some of the newest models like Cloud Opus 4.5, Gemini 3, their capabilities are extraordinary, and the speed at which we got here, it just takes your breath away. And we're here in December of 2025. I don't think we're done this year. I think OpenAI is going to come out with a new model. I think Grok's going to come out with a new model. And like the speed at which things are changing, and the speed at which we have to reevaluate all the time what our options are and what the state of the art is. It's truly amazing, and it's an extraordinary time to be doing what we're doing in the midst of this really amazing change.
It is, and I won't hold you to this, but and I know because you do follow a lot of sports and we chat a lot about the different teams that you bet on, but if you were a betting man, who would you say is going to win that, LLM model sort of arms race? Is it going to be Gemini? Is it going to be Grok? Is who Claude? Who's your bet on?
We could spend a long time discussing the possible. Nobody knows. That's the true, real answer is nobody knows. They all have advantages. I think Google has a very, very strong position, both in their ability to deploy compute with their data centers and the specific chips that they can make, and just the track record they have in that space. I think they're in a very strong place. I think that Anthropic has some amazing models for developers, and continues to innovate at a really fast pace and continues to lead in a lot of ways. Those probably would be my front runners. You don't count out OpenAI though. OpenAI continues to do a lot of great things. That they've recently fallen behind just a little bit, but I think they're going to come roaring right back. So it's really hard to tell, and I'm just enjoying the fact that I don't have to pick a winner. That I win no matter what, because we have the ability to use all these models.
It's so true, and I like the fact that you said, certain models have certain capabilities, and I think you're right. I think you have to kind of dabble with that, and I think that brings us to this whole point about AI adoption. And I know you've been leading here, especially at NetHealth. You've been leading the charge around how we adopt AI within the organization. So as you think back and you think about looking across the organization, and you look at your peers, the CTOs and the CIOs out there. What is the single biggest sort of reality or piece of advice or something that has stood out for you when we think about AI adoption on this journey that you've been on?
Yeah, I would say just understand the time we live in. We live in a time of disruption, and make short-term bets, not long-term bets. We're rolling out an AI assistant internally. We're rolling out Claude for our enterprise. I don't necessarily think, though, that we should expect that we'll necessarily use Claude 5 years from now. There's a very real possibility that either Microsoft or OpenAI could emerge as a leader in the space that they aren't today, right? So we're making a short-term investment, realizing that in the amount of disruption that's happening right now, you just have to you have to make a decision to adopt something, and analysis paralysis will prevent you from reaping the good out of what the current state of the art is. So you do have to, make a decision. The only wrong decision is not making a decision at this point. You do have to make a decision, and just understand that whatever decision you make, be okay with the fact that a year from now, that decision may turn out to be completely different than the one you'll make a year from now.
It's such a key point, and I know you and I've chatted a little bit about this as well. And I think I shared my profound fear as a young girl seeing the Blade Runner movie, and just what the future of AI and robots and all this type of thing might be. As long as that's not aging me too much, Eric, I should have thought about that before I gave that example. But from your perspective, as you think about what's coming next, and you talk about yes, there's this disruption and things. What do you think will become standard in the healthcare space much sooner than leaders expect?
Yeah, I think what's coming next is the elimination of routine administrative tasks. So I think in a couple of years' time, things like prior auth will be something we don't have to think about anymore. Today we spend a lot of time and money addressing things that are very big as far as administrative burden. And I think those are going to be solved problems, and we're going to be able to turn ourselves back to solving problems for patients rather than solving administrative problems.
Yeah, such a smart point, Eric. I'd also say that, as you were mentioning with the models, patients themselves are using AI. Their expectations of providers using AI is steadily increasing, and so I think you're absolutely correct. It's not just administrative things, but I think it's also advances that patients are expecting healthcare providers to deliver. And I do think we all agree prior auth would be a great thing if we could get that innovated. So fantastic point. I think that's the perfect place to wrap this up. We've really covered quite a lot of ground today, so let's recap on some of the biggest takeaways that Eric and I discussed. First of all, AI is shifting from pilot to practice by embedding intelligence directly into workflows that clinicians are already using. And when AI becomes an invisible partner, documentation gets lighter, care teams get time back, and organizations move towards truly human-centered care. But not least of all, adoption is so key. Just like clear workflows and the right use cases, all of that is dependent on having trust right at the center. Thanks again for joining us, Eric, and thank you to all of our listeners. If you're tuning in from Spotify or YouTube, we'd love to hear your thoughts on this episode in the comments down below. Once again, I'm Francesca Vereb, Head of Marketing at NetHealth, and I'll see you next time.